Hey everyone, this is Raj, Doctor of Physical Therapy at 3CB Performance. Today's topic are the notoriously sensitive hamstring injuries which happen to the best of us, like Usain Bolt here. They tend to linger for about 20 days on average and have a really high chance of re-injury. First things first, what the heck are the hamstrings? They're four distinct muscles on the back of your leg. Why do these injuries actually occur during running? So during what's known as terminal swing phase, the hamstrings actually have to lengthen while contracting in order to help decelerate that lead leg. In this picture here, you can see how the hamstring is stretched out during that final portion of swing phase. So generally, eccentric contraction is a higher stress. Think about it like a biceps curl. When you're going down on a biceps curl, it's a lot tougher than coming back up. And that eccentric stress puts the highest amount of load on the muscle. So right here you can see during that terminal swing phase, the highest stress on the muscle at 32% is actually during that last part like I talked about. That's why most of the injuries in fact occur during terminal swing phase. So what's the rehab process consist of? The first thing is manual therapy, where you reduce pain and inflammation. Do not stretch. That will actually trigger more of those fibers to be injured. And then I'll complete manual therapy to help reduce the pain. Then we move into the active rehab, which consists of strengthening, which first starts with isometric, where it's just against resistance. Moving into concentric, as you see here with some bridges, and then adding some more bias towards the hamstrings. And then lastly, we get into more higher level eccentric exercises, such as the Nordic hamstring curl here, which is shown to be one of the best exercises for rehab and prevention of the hamstrings. Then after that, we begin to return to running activity. And that consists of, firstly, it's a running gait analysis to look at any biomechanical compensations, and then a stepwise running and strengthening progression in order to reduce any of those root causes and make sure it doesn't happen again. As I said before, the average return to full activity is about 20 days, so a hamstring injury is no joke. There's plenty of risks with hamstring injuries moving forward, unfortunately. For example, most hamstring injuries are re-injured within the first month, and there's a 2x to 6x higher chance of actually injuring the hamstring, and that risk can last for up to a year. So that does it for this video about hamstring injuries and their root causes and why they happen. You can always follow me at 3CB Performance. For a full compilation of my work, head over to the Injury Insight. Check out my clinical site, 3cbperformance.com. Feel free to reach out and email me if you have any questions.